Can you tell us your name, please?
Tom Brown.
Tom Brown. I'm recording this on video, and with HIPAA regulations, etc., I have to have your permission.
You have my permission.
And a full release will need to be signed for you, so we can use these for educational or marketing purposes.
No problem.
Okay. What's interesting is, Tom, you've presented when you were a kid. You had club feet surgery, and you say your workouts, your calves never caught up with the rest of your body because you're in pretty good shape up above, and you've got some workout devices you've invented that allow you to work ergonomically your upper body. Do you work your lower body as well?
Absolutely.
With both of them? Interesting. I'd like to learn more about that. What's interesting here is I just hooked up, because we were talking about imbalances, how they flow all the way up the body like a kid with building blocks. When it gets out of alignment, it can flow all the way up. And you've got some issues where you've had hip replacement, and then years later had to have another hip replacement to replace the original hip replacement. Is more complex than I want to get into on this video, but you have some complications, and they've been doing a marvelous job trying to balance this out. But right now you've got pain in the side of your thigh here, and no one can explain to you what the genesis of that is.
That is correct.
Now, we brought you in here, and we've hooked up your shoulders to see if you had some imbalances, and we've noticed that your left shoulder is contracting with each pulse of the machine. But the right shoulder is doing nothing. We're not getting any contractions in your right shoulder. Do you feel anything in your right shoulder?
Not at all.
Okay. Do you feel it in your left shoulder?
Oh yeah, every time it
You
twinges.
can feel those contractions every time.
I can feel the contraction, and I can feel it as it sustains itself and starts to vibrate.
And I've noticed that we have visual contractions on the left shoulder. Doug, if you could assist me, we're over here on channel 1 on the machine, and we've gotten muscle contractions at about, less than 10 on the dial. We're about 6 on the dial. We've already got contractions there. It's because you've got some great musculature up here, okay? But you clearly have an imbalance because this left side's contracting, but the right side's not. So slowly, Doug, turn that up slowly. All right, no, stop right there, Doug. Come here, Doug. I want you to see this.
It's still less than 10. So
It's still less than 10. So he's got great contractions on the left side.
I do feel it
Great musculature.
ever so slightly on this side.
You can feel it ever slightly on the right side, but your left side is contracting. We are documenting impedance differences and imbalances bilaterally. You see what I'm saying?
Yeah.
Isn't that interesting? Here, what's interesting to me is how this can flow from the feet all the way up to the shoulders. Now, I still have no visible contractions on this right side. You can feel it now, correct?
Yeah.
But we see no contractions. And the dial is right about a little less than 10 on the dial. Interesting. So Doug, if you'd be so kind as to slowly turn that up.
That's the dial goes to 100, just so you understand. So
Okay.
if we turn that up too much, you'll be bouncing on the ceiling. No, actually,
Yeah.
it won't do that. But it'd actually make you lift your arms.
Okay, go ahead and slowly turn it up.
I think both of them are starting. Yep, got both of them that time.
Okay, where are we on the dial now, Doug?
We are at about 16.
16 on the dial. So we started contracting about 6 on the right side.
Actually, yeah, about,
And
I'd say.
we're almost to 20. That's Yep. Now this is interesting. We went from 6.
You're about 20 on the dial
We
now.
went from 6 on the left side. We were getting contractions. We had to turn it up to almost 20 to get contractions on the right side. So we've already diagnosed muscle strength imbalances bilaterally.
Yeah.
Okay. So this is interesting. This is shedding some light on some of the imbalances that clearly aren't a surprise with all that you've been through. They've actually done a good job trying to make the legs the same length and trying to strengthen the calves to keep up, because you got some serious quads up here. Your thighs are strong, but you've never been able to get the calves to catch up
Never been able to get
with
to
your
that.
exercises. And Why do you think that is?
Because they cut that heel cord when I was.
So when you had club feet as a kid, they cut to be able to correct that, and now you walk without the club foot issue.
Correct.
But the whole foot issue has flowed into the knees and flowed into the hips. Now, what happened with this right hip originally?
The original was a playground accident at age 10, and got an infection.
Was it like a hip pointer? Something hit that hip hard?
Probably just fell on a playground. I don't have a lot of detail. I was just a child on it.
Age 10.
Yeah, so nobody thought anything of it. 2 days later, it was hurting bad, and then
you got an infection.
A month later, I'm still laying around and I can't walk, and finally get to a doctor. And
was this an open infection at the time?
No, it was completely contained.
Okay.
Now, often we find that people think that they fell and that was what the accident was, when in fact it may have been related to the club feet surgery, and that may have contributed to an imbalance in the hip, that the hip was, as a kid, a 10-year-old, you're not going to know.
It's called osteomyelitis was the first diagnosis, and then it was septic arthritis later diagnosed. So, and the septic part of it was the part that decayed the hip, and subsequently had to be replaced because the cavity closed.
Did you take a lot of pain medications when you had your clubfoot surgeries?
As a child, I don't recall. You're pretty resilient as a kid.
Because that can be a causal effect for arthritis.
I also believe that there's probably X-rays. I'm not sure that the number of X-rays that I had was safe as well, as I think I must have had. Literally, I've had probably several thousand. Probably near 3,000 X-rays in my life. That can't possibly be good to be radiated that much.
No, it's not.
41 years old, so I suppose over that time, but most of those were done before I was even the age of puberty.
Yep.
Well, there's a couple studies by the I forget, the National Health Foundation. I forget who it was who did the studies on radiation exposure. And one of them documented that 1 out of every 1,000 CTs they estimated would cause cancer by causing a mutation. But see, the thing is, your risk doesn't increase with the more X-rays that you have, because it's like flipping a coin. Every time you flip the coin is a new time you're flipping the coin. Okay. So it's quite interesting whether or not you got any DNA damage. You still have the same chance every time you flip.
Something was amiss. I have 2 brothers. Both of them started puberty at around 12, 13 years old, and I started at almost 16.
That's 16.
So it's quite a substantial difference.
Well, you've had issues going on with your blood supply, and I'm trying to say that often we find people think it was this playground accident, similar to elderly people who they think they fell and broke their hip, when in fact their hip broke, the thin femoral neck broke, they fell down, and they blame it on the fall. Okay. So there may have been some blood supply issues, compromised blood supply into the hip joint up here, where you weren't getting circulation into that hip joint. You see what I'm saying?
Right.
So the body's immune system couldn't get there to heal the infection that developed. You didn't have perfusion and blood supply. We get that through proper muscle activity that can move out the edema. And if you had some imbalances, often we get edema, fluid buildup, and then we don't have the proper blood supply getting to the capillary, through the capillaries, to the cells to get proper circulation.